I've served at 3 different major institutions of academic prowess: George Washington University, Washington University, and then came to Yale as chairman in 1995, the 100th anniversary of the discovery of the X-ray. I continue to practice about 2/3 time, teaching residents, fellows, medical students, interns, and mainly in body imaging and GU and GI radiology. I've been coming to the RSNA. I think I said before, I gave my first paper in the Palmer House, scared to death, sweat through my suit coat, in I think the red lacquer room, which was about the largest room that they had there at that hotel. And I've been coming here to Chicago for the RSNA meeting and for various service roles in that society since I joined it in the early to mid 1970s. And my research interests have been in, as I said, uroradiology, but specifically in contrast media, which is some people call X-ray dye, that substance that we'd inject into our patients in very large quantities as a non-therapeutic drug, but without that iodine, we wouldn't be able to create some of the images that are on display right here today at the RSNA. So I continue to do that and love what I do, and that's essentially a capsule or a nugget of my career to date. Well, I'm very interested in the history of radiology, and actually edited a book on the history of diagnostic radiology. So I will answer that question focusing on the RSNA as a society and the role of societies in our profession and in the development of our profession. And RSNA has been doing that since 1915. This is its 98th year. I think professional societies have served a very, very strong role and purpose to, in this case of the RSNA, to educate us so that we can educate others. And in fact, the RSNA had been doing that along with the technical displays that have been part of this meeting since I came here for the first time in the mid-70s. I think that if you had to pick a word, my word would be education. And I think that it's one that they have sort of set the cutting edge at and maintained it, sometimes beyond the kin of the people that come here, but they kept doing it. I think in terms of global impact of any society in radiology today, there is no society that matches it. I think the role of a society is also to represent the radiologist as the individual who is most responsible in some ways for the diagnostic process. And I've also often called the radiology department the marketplace of the hospital. And in many ways, the RSNA has been the marketplace for our specialty. You can't ignore the technical aspects of this meeting, and no one does. And I think that there's no society in the world that links the two, the educational purpose, the science, the best science, as a forum to present your best science, and the technology and the technical exhibits. So I think that role has been one that has been a natural for the RSNA, and I might say others have tried to duplicate it, and I think quite successfully, namely the ECR. But I think the RSNA's impact has been the strongest, and for me in my career, it has been the most lasting influence because of my interest in science and technology. I think the status of radiology would be much more fragmented. I think that it would be less, can't think of a better word than magic or majestic in the discipline of medicine. I am very bullish on medicine. I'm very bullish on radiology. And I think that all of us, would have sought education, technical expertise, connections in another forum, because there was really only one society before the RSNA was formed in 1915. And then if you look at the evolution of that society versus other smaller societies or even local societies, I think that that's why I use the word fragmented. And I think the impact on our specialty and our ability to, in some ways, defend ourselves, which we have had to do over the years from politics and policies, would have been much less effective than it was and is with such a strong sort of educational validation, which is what the RSNA really is. It validates, informs us so that we can inform others. And I think that is, to me, the essence of what radiology and RSNA mean to each other. If I was talking to residents today at this meeting or back home where I'll be in a few days working about the RSNA or about our field in general, and I had to title that talk, I think it would be the convergence of change and opportunity that this society has used as its watchword in a way, because they've created opportunities out of almost every change, technological, educational. And I would tell them that, you know, it's like belonging to a gym. If you don't go there, then you're not going to get any exercise. I mean, belonging to a society, if you're not going to participate or go there, then you're not going to really get educated. I can teach you something personally, but not what a forum like this can teach you. So never forget that there's a collision, and it can be a good one, between changes that are happening right here today and the opportunities to improve and maintain that position that we all know and love, but can do a better job at. My first RSNA meeting, I gave a talk on my research, which is on radiographic iodinated contrast media and its levels in the blood of a dog and in the spinal fluid of a dog. My talks 10 and 20 years later were on using that research and the efficacy and benefit and safety of contrast media with CT and now MRI. So the revolution has been dramatic from what I did and what I do to today. And that used to have an argument, actually, a discussion with a deceased colleague, that his premise was, well, I suppose someday you'll be doing an IVP or intravenous urogram with CT, which is exactly what we do today. I just came from a session with 10 papers on that, and we don't do intravenous urography anymore without CT. So the luxury that I've had to both do research, but excited about the challenges that I'm going to learn about at this meeting and the challenges that the RSNA will present for years to come.